87% of medical students at UCLA did some sort of shadowing. 88% at Northwestern, and 92% at a school like Harvard. This doesn't mean that shadowing is required to get into medical school, especially if you already have strong clinical experience, but it surely does suggest that shadowing hours are important for medical school admissions committees. But alas, you don't have any doctors in the family, your campus hospital doesn't allow pre-med students to shadow, and you don't have a car to travel far places to shadow clinics and hospitals further from campus. So it's time to give up. Hang up your dreams of ever becoming a doctor because, well, there's no way you can get shadowing. No, there's always a way, and I'll show you the exact steps to earn shadowing opportunities today. And this video comes with the exact templates that I have used for dozens of students to help them earn shadowing opportunities too. Let's get started. All right, so let's get right into it. Shadowing is going to be as easy as 1, 2, 3. Technically 0, 1, 2A, 2B, and 3. But large picture here, we're going to talk about some expectation setting. We're going to show you how we create a list of physicians and professionals to shadow. I'll show you how to write our actual emails, including the follow-ups 1 and 2. As well as the most important thing that everyone overlooks, the subject lines for those emails. Not all clinics will have public email addresses, so we'll have to figure out how to call and contact or speak in person to these clinics to get access to the physicians. And then what we're going to do after we land shadowing. Let's hop right into step 0, expectation setting. Remember that this should not be easy. Right? And if it is easy, or if a colleague of yours gets shadowing in an easy way, that's just a bonus, right? Remember what you're asking to do. You're asking to sit in a clinic, in the hospital, in a surgery center, and observe a doctor's livelihood, craft, and it comes with the context that medicine is a profession with a ton of intimate health information. People have dangerous health conditions, people have health conditions in places that are kind of embarrassing, and also people just don't know you, and so sharing their health information is a big ask, right? It wouldn't be easy to ask Elon Musk to sit in on one of his board meetings. It wouldn't be easy to ask a master Japanese craftsman just sit in the corner while he makes his knife, spends 10, 12, 14 hours honing the metal, sharpening the blades, and you're just kind of sitting in the corner. If you were doing your thing, playing basketball, playing a video game, walking in the park, doing whatever it is you do for fun or livelihood at this time, just studying, right? Wouldn't you just rather focus on your work and not have to have that like social pressure of a middle schooler or an elementary school student in the corner asking you, oh, how did you study there? Or, oh, how did you get to that answer, right? Or just making sure that they're having a good time sitting in the corner just watching you. There is a lot that you're asking for when you're shadowing a professional. And I think a lot of pre-meds underestimate the ask and how large the ask is, just because you're not, from your perspective as the shadowee, it feels like you're not asking for much. You're just really asking to be in the room, not say anything. You don't have to do anything. But there's inherent pressure to saying yes to that, because we know you're in the corner. We know you want to learn. We know you want to have a good time, but recognize that the profession itself inherently, as well as just the dynamics of having a shadow accompany you to work, that adds a little bit of difficulty. And so if it is easy, that is a great, great sign. But if it is not easy, as you can see here, 1, 2, 3, 4, 5, 6, 7, 8, these are 9 of the 30 plus emails I sent, with one of them giving me, or actually 2 of them gave me a response. Of those 2 responses, one of them said no, and one of them said yes. I would love to have you around. And that one opportunity, after sending 35 plus emails, was the one that opened the door to other shadowing opportunities. So I want you to expect that this will be hard, because a lot of pre-med students send 3, 4, 7 emails. They work hard on those emails. They don't get a response. They just get completely ghosted. Or if they're lucky, they get a response that says no, and then they throw their hands up in the air, shadowing is too difficult post-COVID, shadowing is too difficult 2024, and it is, right? You're asking for a lot. So I wanted to give you an update. This is a text that I got from one of the students. I want to give you an update. Pete's office is not accepting shadowing or preceptorships right now. Still working on the OBGYN and office and putting in a call in addition to my email tomorrow. So I love this text because you recognize that one road closed, but you can just spin off of that road, go to the next option, and continue trekking on and on and on. I sent 4 more requests for letters of recommendations and 2 follow-up emails for shadowing, and I only had minimal anxiety. I also love this because you don't have to be so outcomes oriented, right? When you send that first email or make that first phone call, it is really nerve-wracking. Or am I using the right subject line? Am I being respectful? Am I writing the right words? And so as you get more comfortable with doing it again and again and again, you'll lose the anxiety. You'll recognize that it's okay if someone doesn't respond and it's not personal, right? And then the text later down the line is no shadowing opportunity has worked out. Very common, right? We need to continue to figure out where can we find more providers, so quantity, and how can I reach them in a more high quality way? Can I send better emails? Can I call them at a better time? Can I show up in the clinic personally in person? These are the things that you can change that will affect more and more shadowing opportunities, so that hopefully one will work out. But I think this one's always important. It's not truly a step, but it's an understanding that this is going to be a difficult process. All right, so now let's actually get to how to create a list of physicians or healthcare adjacent professionals to shadow. There's 2 different options. There's a pyramid approach, and then there's an interest-based approach. I'll talk about both. You can combine both of them, or you can choose one that floats your boat a little bit better. So this is a pyramid, right? At the bottom, there's a ton of options, but maybe less personal or intimate. At the top, there's fewer options, but more personal or intimate. So at the top of the pyramid, you have friends, family friends, and friends' families. So like if you have Uncle David, who is a doctor, or Uncle Tom, who's a PA who works with doctors, they might be at the top of the pyramid. They're easier to access, easier to ask a question, easier to get a referral. Maybe your friend Kathy's dad is a physician, bingo, and his son is a medical student, so maybe he knows someone from his pre-med years. And then Vinay's brother is an anesthesia resident, so maybe he would know someone in the area. These are kind of options at the top, right? Hit your low-hanging fruit first. And then you go down and you have the personal pediatrician or the family physician. This is kind of one step removed from the inner family circle. You got like your own doctor. This is like my doctor growing up, Dr. Higo. And then down one more, you have hospital directories. You might, number 2, you might put your father's doctor, your mother's doctor, your cousin's doctor, any physician that sees maybe your family members or friends. And then hospital directories, wherever your campus is, there will be surrounding hospitals, right? UCLA I went to had its own campus hospital, and so it has its website and its directory. It has Cedars-Sinai, which is in the area, accessible by bus. Huntington Hospital is a community hospital nearby. Garfield Community Hospital, USC, is a academic hospital, but in a community setting. And then San Gabriel, another community hospital. Well, great thing about these directories, especially the academic ones, you click this and you get a list of literal providers that you can reach. And if you try to Google like UCLA directory, you can also find their contact information. So we go down the line, Ryan Pham or Daryl Lum. So let's see, Daryl Lum looks like a nice guy. Maybe he would be open to shadowing, and you can click into the campus directory, Daryl Lum. There's a phone number, and if you hover over this, you can look at the bottom right there, dlum40 at mednet.ucla.edu. Also a way to get his direct email address. So utilize campus directories. Just Google your campus directory, and then you can start finding these folks. All right. So that alone, this directory alone, I don't know how many physicians there are, but at least 652 that are in the area, and that's just in primary care, right? You might have other interests. These are 3,423 results in the greater Los Angeles area that you can access. All right. So those are hospital directories. You get even larger. And then now number 4 is when you expand the context of practice, and it's not just hospitals, but now you're looking at outpatient clinics. You're looking at community clinics. You're looking at doctors who do home visits. So you can Google Los Angeles home visit doctor. Hospice centers will also have physicians. Federally qualified health centers will also have physicians. There are these centers that continue mental health care outside of the hospital called partial hospitalization mental health centers. There's nursing homes, urgent cares, dialysis centers, chemo. There's just 1,000,001 different settings that healthcare is practiced. All of these are options. And if you say, whoa, Mike, that's a lot of things to Google. Yes, it is a ton of things to Google. This is what hard looks like. This is how difficult it is to get shadowing in 2024. But because people are so overwhelmed by how many options there are and the work really to look up all these things, they will stop. And so that gives you an opportunity to continue going, go past the discomfort, keep Googling, keep searching, keep looking, and one of those doors will open for you. Next is to pull the thread of different patient populations to match your interests or themes. So if you don't want to think about where healthcare is practiced, think about who it is practiced for. And so if you're interested in higher SES populations, lower, more or less health literate, neurodivergent, Spanish speakers, Vietnamese speakers, immigrants, LGBTQ positive, incarcerated individuals, chronically ill, like transplant, genetics, Parkinson's, Alzheimer's, there's just 1 million people who require healthcare. And so starting there and putting that in your Google entries will also help you create a list of people to search and reach out to. Next, we have this interest-based approach. I can explain it here without that video, but essentially, if you look at this picture here, it's a person, problem, populations framework. So the question that you're trying to answer is, what people, problem, or populations am I interested in, right? Some examples in the past from our students. Notice this does not say orthopedics or cardiology. It also can say those things, but it also can say things that are simpler, like Vietnamese speakers or immigrants or middle-aged women or women undergoing menopause or women having children, right? In these examples, I just talked about what some of our students were interested in: addiction, weight loss, mental health, integrative health, heart attack, stroke. And there's a ton of people, not just doctors, that work in this space, right? And so having a full-scale understanding of the ideal patient journey, who should a patient see to control this condition, is very, very valuable. Because not only do you become an expert on what they struggle with and what the existing solutions are, you can start noticing where there are gaps and where the entire healthcare system can improve. You'll couple the lab science with, so if you, let's say you're also doing research on diabetic patients or research on weight loss, you'll actually meet real people who need those solutions. And you'll meet their providers, their doctors, their therapists, the social workers, the dietitians. So let's talk about 2 ecosystems: the addiction ecosystem, the weight loss ecosystem. So for the addiction example, you have Alcoholics Anonymous. That's where some people struggling with alcohol addiction are. You have a primary care provider who will refill their methadone that they use for substance abuse. The highs and lows of relapse, if you're getting to know more and more people experiencing addiction, you'll learn and remember these stories about their triggers, how they were sober for XYZ years and then relapsed because of ABC, things like this. You'll get to know the public health research as well as the basic science research. A weight loss ecosystem is another example. You'll start picking up these quotes, right? If you really listen to the patients, they will tell you a ton. Here are real quotes that I have heard or some of my colleagues have heard about people struggling to lose weight. Quote, "I sweat through my shirt when I'm walking down the streets of Los Angeles," right? That's a very salient, powerful quote. It's so much so that he doesn't actually want to wear white anymore because he feels embarrassed when he's walking. Like, that is how weight affects him in his day-to-day life. You have the 3 to 5 different fad diets at any one time, from the keto to the vegan to the carnivore diets.
You have the PCP telling him they have high cholesterol, but only really having 7 minutes in the visit to explain to him what that is and what he needs to do. There are the stories of their friends and their cousins and their family members dying because of heart attacks and strokes. Someone wanting to be there for his daughter's wedding, but fearing that he won't because he's already had 2 heart attacks. There's basic science research, public health, adolescent teen programs for people who are teenagers who are already struggling with their weight. There's surgeries like bariatric surgeries, gastric sleeves to make stomachs literally smaller. There is special trained OBGYN physicians who are experts on pregnancy for patients that are much heavier. I can't stop binging and purging, another quote, pharmacotherapy, dietitian meetings, restrictive diets, painful exercising, and cheat days. You can start to see, like, if you are very interested in weight loss, you really get to understand the mental space that they're in, what's important to them, like the daughter's wedding, the options that they have from surgery to diets to the primary care provider to the pharmacotherapy, all this Ozempic stuff that is new. And you see, I wrote a lot of different providers that help with people struggling with weight. Bariatric surgeons who can literally operate, high-risk pregnancy OBGYNs, maternal fetal medicine OBGYNs right here, and then eating disorder psychiatrists if you feel like you're binging and purging and that's like a mental block for you. Dietitians who can help manage your plate and help educate you regarding food and quality of food. There are weight management doctors. There are endocrinologists that specialize in weight management. Gastroenterologists, primary care providers. There's tech companies like Whoop and Fitbit and Noom that are all about weight loss. Diet companies like Weight Watchers and Jenny Craig. Hospital nutrition programs, like what does a nutritionist in a hospital do? Integrative health, wellness providers, clinical psychology. You get the sense that there's way more than just one type of doctor or even one type of provider, right? Dietitians, psychologists, tech companies, diet companies that are all involved in this problem. And so if you're interested in something in particular and you want to be well-versed while you are shadowing, a great idea is to see the entire spectrum of people who work in that space. And as part of the resources that we have for you, this is a Excel sheet template that is essentially plug and play. You can use to fill out what people, problem, populations you care about. Here are the examples that we just talked about. You can keep the physicians' names, their specialties, their contact information, their websites, and then track how you're doing, right? Have you sent the email and what was the response? When did you send that first email? When are you supposed to send the follow-up emails, right? All of this can be tracked on this one tab to make everything nice and clean for you to use. Okay, so now that you have a list of, I would say, try to get to a list of 30 or 30 to 50, right? This list has a ton of people, all the way 93 people, which I love the extra effort. I love the spread of endocrinologists, weight management, dietitians, eating disorder, high-risk pregnancies, bariatric surgeons. That would be 17 to 90, so about 80 providers here. Try to get to that 40, 50 number at least. And then what do? We have to find their contact information, which is just a lot of Googling. And then we have to write these emails, right? So we have templates and phone scripts that we use for our mentorship students. But of course, we're going to share that with you guys today so that you can also benefit from it. So the word for word email templates and phone scripts are here. I will review them with us now. So let me move my big head over here. All right. So you get plenty of things, right? From subject lines to the actual email template, which is completely plug and play, right? All of these are pretty much all filled out except for some of the stuff in bold, and they're simple, right? Your availability, your phone number, your name, your school, why you're interested is going to be one thing that you're going to spend a lot of time on to fill out. There are email samples for you to use, and then there are follow-up emails that are already plug and play, copy and paste for you. Follow-up number 1, follow-up number 2, follow-up number 3, what to do if they respond and say no, what to do if they, if you want to keep the door open, they are not available now, but they may be in the future. And then there's exact phone scripts and voicemails for physicians you know, for physicians you don't know, and then for front desk or receptionists or medical assistants. All of these are pretty self-explanatory. I'd like to spend a little bit more time on the subject line options as well as the first email. So remember, subject lines are the thing that your provider will see, right? If they never open the email, at the very least, what's most likely to happen is they will see your subject line. The subject line will dictate if they open the email, and then the rest of the email will decide if they want to respond, right? But if they never open the email because the subject line is so terrible, which it typically is, then you will never ever get a chance, no matter how good your email is. So spend a ton of time on the subject line options. A test you can use is called a Starbucks test. Starbucks test is essentially if the provider opened this email in line at Starbucks while waiting for their coffee, would they open the rest of the email, right? So it's got to be intriguing. It's got to be enough to get their attention. And so you can see some of my options require a little bit of digging, right? So if you see on their website that they opened an integrative health practice, a subject line would be, I saw you open an integrative health practice, or I read your recent article published in ABC, right? What were your biggest takeaways caring for patients struggling with obesity? If you know on their website, they take a lot of care to care for patients with obesity. And asking a question in the subject line may get them curious because they see themselves as experts or someone who has worked with plenty of patients who have obesity. What have you found most interesting? Can premeds benefit from early exposure? Your work inspires me. Your work inspires me. How can I learn about this? How can I learn more about that? My friend struggles with obesity, substance abuse, binge eating. I'd love to learn more, right? Spend time making sure that your subject lines are tailored and specific, and you will not regret it. Because if you have emails like this, which is a huge mistake that I made early on in my journey. Michael Lee, shadowing interest. Michael Lee, shadowing interest. First of all, everyone will look at this and be like, I don't know who Michael Lee is. He's interested in shadowing. It's only me. So I don't actually care, right? I see this guy's uploaded his CV, uploaded his resume, he wrote his name, and he's just interested in shadowing. And look at the preview. I am interested in pursuing research, looking to shadow to further. It's just not... He is not offering anything to me, right? And to be fair, premeds will not be able to offer a lot in the clinic. You're not going to be doing injections or splinting up patient legs or helping diagnose patients. But what you can offer is time, attention to detail, curiosity, things that every mentor love in their students. You can offer that. And the more time you spend on the subject line, doing your research about them and their career, the more they'll appreciate it, right? It's less coming from a me point of view and more of a, I respect your craft. This is what I learned about it when I was reading about you. Thank you for doing your work. I'd love to learn more type of thing. That's harder to say no to than me, help me, right? So those are subject line options. The email template you'll see also reflects this idea where you have to do research up front and it's about them, not you, right? I hope this email finds you well, some niceties. If you have a referral, like someone you know, your cousin's doctor, or this is your friend's father or whatever it is, please put that up front so they know like where you're coming from and how you found them. And then I found your contact info when researching blank. That's super interesting because, and you have to delve into this part right here, why you care about that person population problem, why you're interested in that provider or their career. Build that common interest or passion here and do it in an effective way. It doesn't have to be 5 paragraphs. It can be 2 or 3 high quality sentences that showed you did your research, that you know that they published something recently, that you know their website is featuring XYZ, that you know their career brought them from UCLA to USC to now New York, right? Something to show that you did a little bit of extra research on them. And if you can't find anything, in my opinion, that is just a sign that you haven't looked hard enough. So for example, we can take a look at the most recent provider, Dr. Lum, together, and we'll take a look, right? Internal medicine, Tufts. So he was from Boston, went to UCLA, and has been at UCLA since. So if you're from Boston, that's That's a topic of conversation. If you've been a triple Bruin, that's a topic of conversation. He works in the internal medicine 100 office, areas of focus, primary care. So not much on this page, right? But if you Google him, let's see what else comes up. You can see his health grades, dear alum, medical news today, medical UCLA profiles. Let's see what he has here. So professor of medicine, D-Lum, medicine, okay. So again, still not much. Then I found this website by just Googling Darylum UCLA. And let's see a little bit more information here. Darylum is graduated from Stanford. Maybe you were from Stanford or up top. He graduated biology in 1991, went to Tufts and UCLA. His clinical interests include primary care and cancer screenings, and during residency obtained additional training in flexible sigmoidoscopies. You might Google what that is, right? It's a type of procedure that typically gastroenterologists do now. Joined the faculty in 1998, whereas primary care, okay, medical student, house staff education. So he's been interested in education, sought after instructor, physical exam, has been a preceptor, served as ward attending, Central California. I mean, are you from Central California? Swimming, running, and biking. Do you like swimming, running, and biking? Competitive triathlete. Are you a competitive triathlete? Medical care, education, and all this other stuff. Okay. So his goal is to provide medical care to allow people to live healthy and productive lives. If that's something that you resonate with, bringing that up is also fantastic, right? So I didn't do too much digging, but I was able to find where he's from, Central California, where he went to school, spent in Boston. He's doing some sigmoidoscopies, he's interested in cancer care. He's a triathlete. If you're not a triathlete, then maybe someone you know is a triathlete, et cetera, et cetera, et cetera. She also went to Tufts, so maybe you ask him. He graduated in 1995. She graduated in 1991, so maybe they didn't know each other at that time. But you can see she's interested in sports medicine, Durham, women's health, and then this is kind of orthopedic stuff. Married with 3 children. Husband is a wealth management advisor. Okay, great. So there's always stuff to pick up on when you're doing your research. And this is the hard part, right? Doing research on 80, 90, 100 different physicians to send out high quality emails, just to write 2 or 3 high quality sentences about them that says, I saw that you are a competitive triathlete. That's super awesome. I'm looking to get into my first race. Like, what is your recommendation for a starter bike? Right? Something like this. I just thought of this off the head. If you're not interested in that, then maybe you're also from Central California. I'm from Modesto. How has Modesto changed for you in the last 20 years or something like that, right? All right. So though that is the email part, and then you'll also, if you scroll down, you'll see the phone scripts for physicians you know or you don't know. You can follow the script by word, or when you have a voicemail that you need to leave, you can leave it like this. Hope you're doing well. Found your contacts. Your practice is super interesting. Again, why? And then my name is blank. I attend this. Would you be open to me shadowing? Right? And then adding a callback number and an email address. So these are things that you can use today once you have a list of physicians that you want to reach out to. All right. And if you send the right number of emails, and if each email is high quality enough, I have high confidence, just like it has worked for dozens of our own students. I have high levels of confidence that you will be able to connect with a provider who is willing to give you a chance because of that hard work and curiosity you displayed. If you have not, then perhaps it is a quantity or perhaps it is a quality issue, right? Can you send more emails? Are you at 30, 40, 50 quite yet? On the emails that you do send, look at from top to bottom. How is your subject line? How is the email body? Are you writing in a way that encourages responses? Are you putting your full availability in that email so they don't have to work so hard to send their calendar, or you send your calendar, go back and forth? Are you doing it so that it is easy for them to say yes, right? If not, improve your subject lines, improve the writing of your emails, and increase that quality. Keep playing with those 2 levers. It's the quantity or the quality that you can improve And eventually, if you take ownership of this process, you'll eventually get to a place where someone will give you a chance. And that chance will open up many, many doors. And once you have a door open, you've landed the shadowing, now what, right? This can be in its own entire video, but I'll leave you with just an early primer as to what I shared with another one of our students who earned shadowing. And I wrote that the number one thing you can do is show up early, right? Showing up late just soils everything from the get-go. Just in the beginning, spend a couple of minutes earlier in the day before you see patients and ask, like, how do you think I can get the most out of this experience? Should I be learning about the pathophysiology? Should I be focusing on the workflow? Should I be focusing on how you talk to your patients, right? Your doctor will have a sense of what they think may be the most informative thing for you, right? If this doctor is a person who gets to work, like they're typing notes or they're preparing for their cases in between patients and isn't really keen on teaching you or talking to you because he's writing notes, then get to know the rest of the staff, right? The receptionists, get to know the administrators, get to know the office managers and the pharmaceutical reps that come in during lunch, right? Be curious about what they do and get to know them because they're part of the clinic. They're part of the entire team. Get to see a patient come in through the front door and see who they interact with. They interact with the front desk staff, then they go to a medical assistant who does their vitals, then they sit back out and wait for the doctor, then they wait in the room, and then maybe there's a PA or an NP that gets them started, and the doctor finally comes in at the end, right? Get curious to know about the patient experience. I wrote here that I remember meeting a receptionist who loved Disneyland, and we bonded over that. She gave me so much I didn't know about how much of a headache insurance can be when you're running your own clinic. Ask for a list of patients in the morning if they're okay, and if the doctor's okay with that, and their chief complaints, so you can spend some time reading through their chart and reading about some of the basics of their conditions, right? Do you know what a fibroid is? Do you know what adenomyosis is? Do you know what cancers are, right? The gyne cancers. And then most importantly, at the end of the day, do not leave immediately. Get out of the office, sit in your car, don't drive off. Just for 10 minutes, reflect on what you remembered, the patients that stood out to you, the interactions with the office staff that just were memorable for you, and just set a 5 to 10 minute timer and dump all of it into a notebook. There's an app called Otter that does a great job of doing this. There are journaling apps like Day One, which are fantastic, or just have a paper notebook to write down notes, right? Save the details, save the quotes, save the interactions, save the patients and their stories. Write those down because you will continue to reflect and you will undoubtedly use those in the future. If you have any personal interest within gyne or women's health, in this case for this student, then feel free to ask the physician about his thoughts on serving those folks as well. So that is how you make the most out of shadowing. We'll do certainly follow-up videos to explore exactly what you should be wearing, the types of questions you should be asking, the notebooks to bring, everything, the whole 9 yards to do all of that. Okay? So this is the step-by-step breakdown on how to get shadowing, everything from what you should expect it to look like to how to create your list of people to reach out to that should honestly include people that are not just physicians, how to write the exact emails that will get responses and their subject lines and their follow-ups and what to say when you call them and you get someone on the line or when you don't get someone on the line and you just want to leave a voicemail. All of that is available in our word-for-word scripts documents, which I will undoubtedly link for you all in the description box below, and what to do briefly when you do land that shadowing and you're prepping for your first day. Thank you again for your time and attention. Hopefully this was helpful, and I will see you in the next one. Goodbye.
Hopefully this video showed you just how simple it is to get your next shadowing opportunity. The word-for-word email templates and phone scripts are always free, available in the link in the description box below. And if you liked this video, you'll love this video here, where I walk you through step-by-step how to get a research opportunity to accommodate and accompany your new shadowing opportunities. We're building that resume together, getting you closer to your doctor dreams. Thank you again for your time and attention, and I'll see you in the next one.